Hi, welcome back to iDental. I'm your host Amelia, and today we'll be interviewing Dr. Nelson, and he'll be telling us what a root canal therapy is. Dr. Nelson, how do you complete a root canal therapy?
Well, initially when we perform the root canal therapy, we make a small opening in the top of the tooth to access all the canals. When we get done, we need to close that up, I'll say immediately. So we will place a composite resin in there, but the tooth is weakened and we need to cover the tooth up with a crown to ensure the integrity of the tooth, that it doesn't fracture. Just like most everybody has known someone in their family who has a fireplace and they try to split wood and the wood is green and it doesn't want to split, but after it dries out over time, the wood splits real easily. Our teeth are the same way. That blood supply inside the tooth provides moisture and prevents the tooth from becoming brittle. After we perform root canal therapy, over time, the tooth becomes more brittle and is in danger of being fractured. So we tell people that they definitely should have the tooth crowned or get a cap on the tooth after root canal therapy. There are a few minor exceptions, which might be a bottom front tooth that has a very small opening. But the exceptions are small, but I'd be happy to discuss that with the patient after the root canal therapy. At iDental, when we do our crowns, there's two different ways of doing a crown. The conventional way is with impression material, and some of the doctors here do still prefer to use that. I personally prefer to use the intraoral scanners because that way you don't have the goo inside your mouth from the impression. It's very, very accurate, and the image is sent through the internet to the dental lab, and we get the work completed faster because there's fewer steps involved. They don't have to take an impression, pour it, digitalize it, and then make it and then send it back. It just eliminates a lot of steps. It makes it, in my opinion, quicker, better, and less intrusive on the patient. We have a digital scanner over here. We have the top quality scanners that are running 3Shape software. We have 3 of those scanners so that we always have them available as we need them. Root canal therapy is to allow you to keep your tooth. It's needed to be done when either the tooth is dead and you have an abscess at the end, or if you have what they call an irreversible pulpitis. The inside of the tooth is so swollen that it will not get better on its own. If you have that, the only course to get out of pain is to either extract the tooth or to have root canal therapy done. People are used to thinking of in terms of the tooth having a nerve and getting a nerve taken out, but it's more than that. There is a nerve, artery, and vein that goes inside of your tooth up the root, and when I say up the root, some roots will have more than one canal and some teeth will have more. It just means that it takes a little bit longer. It's not a scary thing, but if the tooth material is allowed to stay inside there and get infected, that's when we have more pain. And our goal is to get you out of pain and allow you to keep your tooth. When we perform root canal therapy, we use what's called Wave 1. It's an oscillating titanium-based file system that you use that to cleanse the inside of your tooth. We also use a bleach solution, so I tell my patients it's going to smell like either a swimming pool or laundry day, whatever is a better memory for you. If you think a nice, clean, fresh, white laundry is a good smell, that's what you'll enjoy. It'll just be a slight smell of bleach while we're working on your tooth. When you're done, you shouldn't experience pain, some minor discomfort that usually some ibuprofen will take care of. And then your tooth can be restored with a crown to cover it up, which is an important part of keeping your tooth. The entire procedure, usually people want to know how long is it going to take. We usually schedule an hour for molars. Other teeth will take less time, maybe a half hour or so. It doesn't take a long time. And then the other thing is, does it hurt? And I say no. We test your tooth with some stuff called endo eyes to make sure that your tooth is completely numb before we do the root canal therapy. So there's no pain during, no pain after. It's the pain before you come in that everyone complains about. during and after, no pain. Just slight discomfort from getting the local anesthesia.
All right. Thank you so much, Dr. Nelson, for your time and answering our questions for our viewers here today.
It's my pleasure. Thank you.
Of course. All right. That wraps up today's video. Be sure to follow our Facebook at iDental as well as our YouTube. Make sure to subscribe. You can check out our website at identalwisconsin.com, and we'll see you in the next video.